Medically unexplained symptoms are very easy to understand if you think in a very simple way. They are again similar symptoms to any physical illness. To give you an example, chest pain, headache, backache, joint pains. What is significant in medically unexplained symptoms? The symptoms the patient experiences when put together doesn't give you a diagnosable illness. So these symptoms are not compatible with a known illness or a diagnosis. And when you do investigations, most of them are negative and you can't find any physical sign. To put it in a very simple way, it's like an animal with an elephant's head, cow's body, rat's tail, and rabbit's legs. It doesn't fit in. That's all. For example, if you get cardiac failure, there are certain signs and symptoms which make it a syndrome. When you do a ECG, you can find findings. When you do an X-ray, you have additional findings. When you auscultate, there are additional findings. But when you get medically unexplained symptoms, those symptoms don't cluster together. So that's the easiest way to understand medically unexplained symptoms. The other feature of this particular animal, as I say, they have set of symptoms. These patients are generally chronic, which means it's more than few weeks, more than few months. They have been to many different doctors. During our research, I have found the great majority would go to the family physician, but they would also consult physicians, then surgeons, then neurologists, then gynecologists, then obstetricians. They go to different specialties and they also go to alternative doctors. But they don't go to psychiatrists, which is in a way not bad. So, to recapitulate, they have multiple physical symptoms which don't fit into a clear diagnosable illness. They have seen a large number of doctors. It's chronic. And these doctors have done numerous investigations. The great majority of investigations are negative unless you find something incidental. And to add to that picture, most of them give up their job if they are employed, or if not, they give up their household chores. And again, they have spent a lot of money, their own personal money, as well as they have been a burden on healthcare system. So that's the animal we are talking about. So if there is a patient who comes to you with many physical symptoms not fitting, and being to many doctors who had investigated them with many different investigations without finding anything, they can't find a diagnosis that very nicely fit in to medically unexplained symptoms. Then you might think, you may be worried whether there can be any other illness. Yes, the great majority of people, about 30% would have associated depression and anxiety. Some may have diagnosable physical diseases incidental, but the great majority of them have neither medical nor physical illness. There are symptom perceptions. But the crucial thing here is, if you go by the medical model, you can't find anything. But if you go by what we call the patient's explanatory model, simply meaning asking the patient what they think, they would come up with very significant statements which are very helpful to diagnose. To give you an example, I had a patient who had chest pain and many other joint pains, back pain, headaches, but his main complaint was chest pain. When I asked him, what do you think? He had been to many different doctors. They said doctors have told many different things. They have taken ECGs, but they couldn't find anything. Most of them said there's nothing wrong. When I asked them, what do you think? They say, I think I have got heart disease. Then when I ask, why do you think so? They say, my father was 50. He had chest pain. He died. My grandfather was 55. He had chest pain. He died. So the patient is frightened. He is frightened about death. Just imagine yourself. If you think you have got cancer, you are going to die. Your friend actually had cancer and is going to die. The fear is no different. What happens when you are frightened? You start thinking a lot. You think about your loved ones. Then you are more preoccupied about your body. Then you would pick up more symptoms. Just imagine, while I am talking to you, you are breathing. If I ask you to close your eyes and concentrate on your breathing, you will feel that you are breathing. That's a normal personal perception, which is normal, which you don't notice when you are distracted, when you are working. But when somebody concentrates on their body, which generally happens for people who have multiple physical complaints, being too many doctors, they are always preoccupied about their body. So they pick up sensations. The crucial issue here is you perceive the breath. You know you are breathing. But if you tell me you are going to die, if you attribute that sensation to death, that's where the link is missing. So you have to do a very simple thing. Acknowledge that patient's perception is genuine. It's not malingering. It's not produced deliberately. But the thoughts around that sensation is what we call counterproductive or not helpful or dysfunctional. Based on their perception, they are frightened, their adrenaline goes up, then they feel their pulse, they feel their heart beating, they start thinking more and more. They come to doctors. You all do unnecessary investigations, which we call the iatrogenic contribution. Then what happens? More you investigate, more negative findings, the patient thinks you have missed something or you don't know about it, you are not telling. So what you shouldn't do is, once you diagnose them, never tell them that there's nothing wrong. Acknowledge that their symptom perception is normal. Tell them there's no point in doing many investigations which have been done in the past, which are going to be negative anyway. And doing such investigations are counterproductive. So you have to reassure the patient to say, yes, you have got some form of illness, like that animal I described to you, but you are not going to die from this particular symptoms or collection of symptoms. However, I also use humor to manage them. I tell them, when you go on the street, if you are hit by a bus, you will die, or bitten by a snake, you will die, but you are not going to die from these symptoms. So what you really need to do is to retain them, diagnose them, retain them, see them gradually. Don't do unnecessary investigations. Don't prescribe medication, because what happens with the doctors, they say there's nothing wrong, but they prescribe. So the patients start thinking they may not be literate as you and me, but they think, if there's nothing wrong, why did they give medication? If there's nothing wrong, if they're confident, why did they ask me to do more investigations? I actually explain to them using metaphors. That's how I change the way they think. What you really need to change the way they think. I tell them, I left 100 rupees on the table, you didn't take it. But if I tell, may I check your wallet before you leave, what does it mean? I don't trust them. So I use that analogy and tell them I'm confident and therefore I'm not investigating. Then sometimes they ask me, what would if I die? So then I, again using humor, say, you have no choice, your wife has to bury you. But I'm confident that you are not going to die from this. What I generally say in Sinhala, make a bayanaka barapatala maraniya rogyak neme. Reassure them appropriately. Don't do inappropriate investigations. Calm them down, reassure them, and you say, you come and see me in week's time, 2 weeks' time. You retain the patient, you check them regularly. So even if a new symptom appears, you can pick it up. So family physician is the best person to diagnose them, retain them, and manage them longitudinally. Just put yourself in the situation. If you are posted to Dambulla hospital, you don't know how to measure your blood pressure, patient's blood pressure. That's a basic tool you need. Similarly, if you are working in a busy clinic, whether it's primary care, gynecology, surgery, this is something cross-sectional. People come with abdominal pain and doctors operate, it's not appendicitis. People come with heart, chest pain, it's not heart disease. People come with breathlessness, joint pain. So this is a pathology, an illness, or a category you would see across all the specialties. So therefore, it's your primary duty to learn about this. Be trained about it. You need that skill to manage this, because they have a disproportionate consumption of existing health resources. They have a big impact on health system as well as their personal lives. You just start thinking along these lines. Start thinking about the next patient when you get, and then you would agree with me. All what I told was based on research done in Sri Lanka. I'll stop there.